Oklahoma consistently ranks number 2 or 3 in the nation for having the highest number of people suffering with mental illness. While most will not commit violence, many Oklahomans afflicted with mental illness live in a delusional state of fear. They won't seek treatment and refuse it when offered. In Tulsa, an experimental approach to treating those individuals is resulting in not only improved mental health, but physical well-being as well.
It's like a bag of beans that you can make beans with.
I got beans.
Beans are that's healthy. That's not going to have a lot of sugar.
I was thinking about buying some chili.
Registered psychiatric nurse Elizabeth Bausch visits with one of her longtime patients as psychiatrist and family physician Dr. Eric Vanderlip listens in. Rachel is 42 years old and has suffered from schizophrenia since she was in her early 20s.
I think I was always on the verge of really going crazy. But it never was going to happen. But one day I asked my boyfriend if he could get us some LSD. And when he did, that was the worst thing I could ask anybody to do.
That was her first psychotic break from reality. During her many episodes of psychosis caused by the illness schizophrenia, Rachel didn't realize anything was wrong with her.
I started looking back to all the times I ever had a schizophrenic moment, and I thought everything was okay, and I was thinking okay. I was erratic, my thoughts were erratic, and I turned around in the middle of the street to look around because I heard a voice that, turn around, she's going to be there.
Her life has been a web of confusion, hospitalizations, homelessness, as well as social and behavioral problems. But Rachel has been leading a fairly stable, managed life in the past few years, after she was identified and met the criteria to be a member of the University of Oklahoma Tulsa Impact Team.
People put on PAC teams do not like the healthcare system, do not trust the healthcare system, do not trust us. This is why they have failed traditional outpatient so many times. This is why they don't have a regular psychiatrist.
The team found Rachel a home at Altamont Apartments. It's one of the many residences the Oklahoma Mental Health Association owns and manages to provide affordable, safe housing for those impacted by mental illness and homelessness. How do you like Altamont House?
Oh, I love it here. I really do. It's like a home, like a family. It really is.
Every morning at OU Tulsa, the professional members of the team meet to discuss the people they serve.
We actually played a little bit of a game of pool while we were talking. I modeled appropriate social behavior. He was very appropriate in his behavior and his manner.
In the room are licensed mental health therapists, case managers, nurses, a recovery support specialist, psychiatrists, and administrative assistants. The statuses of team members vary greatly.
I assisted him with budgeting and healthy food choices. He shopped well and got along well with others.
Refusing to take antipsychotics. Talked to him a lot about concern, about his driving, his mental status, physical health. He denied it being an issue. Some psychosis and delusions. Just making random bizarre statements.
She was asleep upon arrival, very lethargic, sedated, falling asleep during the visit, was not able to stay awake. The visit was ended just due to Tamara needing to go back to bed.
Physical health is also evaluated.
He discussed his most recent cardiology appointment and the medication that needs to be discontinued.
The professionals see each of the 72 team members a minimum of 3 times a week. It can be intense work.
We go to meet them wherever they are. We literally find them under the bridge. We find them at the homeless shelter, the day center. We've gone and seen them in jail.
The OU Impact Team considers itself a hospital without walls that also provides wraparound services to help members find housing, receive Social Security disability, as well as managing their medicine and physical care.
This experiment that we have in the Impact program is super unique. It's one of probably 4 or 5 assertive community treatment teams around the country that are thinking about how to hybridize medical care within their assertive community treatment model.
During this visit with Rachel, Dr. Vanderlip investigates why her glucose level is so high.
And are these your insulins?
Yeah, this is my insulin.
Can I take a look at them real quick?
Yeah.
What do you got?
She has 2 different types.
I know. So this is your long-acting one, right?
Yes. But I've been trying to control that by not drinking pop or, at least if I do, I only drink 1 or 2.
So you've been cutting back on your pop consumption.
Yes. Yeah, Kyle.
Good for you.
I know.
Every 2 weeks, we sit down and we run a list of all of our patients, and we look across their certain chronic illnesses, like their blood pressure values and their cholesterol values and all these other things, and we troubleshoot those who haven't met their goals yet.
Since the integrated healthcare model was implemented in the last year with funds made possible through Obamacare, the incidence of uncontrolled hypertension among OU Impact team members has been cut in half, and close to 100% are screened yearly for high cholesterol. The blood tests are of particular importance to those taking antipsychotic medication, which can elevate cholesterol to dangerous levels. It's hoped measured success in Tulsa will serve as a national model for duplication in other states.